Professor. I would at first like to greet everybody on the behalf of the delegation of Curacao. We would like to extend a greeting to all the participants. Unfortunately, our delegation was not able to make it to Antigua due to a canceled flight. But I'm happy, nevertheless, to be able to present to you here today online. And I will do my best to showcase to you guys how you can leverage healthcare claims data to generate actionable insights. I'm going to share my screen now. Okay, so I will start with the leveraging of healthcare claims data. My name is Dennis Arrindell, and I am a health economist working at the Social Insurance Bank of Curacao. And in that capacity, I do a lot of data analytics. So I will first briefly give an explanation about what the Social Insurance Bank does. The Social Insurance Bank is the executive body of social insurance in Curacao. And in that capacity, provides, amongst other things, the basic health insurance. All right. So we're going to first start. What is claims data? Claims data is an administrative information that details the activities that has taken place in hospital and consequently allows providers to be paid for these activities. Many of you will probably be familiar with this slide over here, which is a framework created by the World Health Organization that allows people to categorize healthcare systems based on their functions. All right, so it is important to understand where claims data falls within this context. Claims data falls between the functions purchasing and the function personal health services, with purchasing in this case means the insurance company or the government purchasing healthcare output, and the personal health services are things that are delivered, products and services delivered by doctors and pharmacies, etc. Over here, you will see a very simple example of what a typical claims data set will look like. This is based on a claims data set from the Medicare in the United States of America. But you can see that claims data has very specific types of information containing, for example, the patient ID on the left, the date on which a procedure took place, the procedure ID, the name of the procedure, the amount of procedures, the amount paid for the procedure, the name of the provider who delivered the procedure, etc. So this is a very typical example of what a claims data set looks like. And this is produced by systems that are by the IT systems of organizations. For example, as the previous lecture indicated about how data is generated in the healthcare setting. So the question is, what can we do with once the data is generated? Once the data is there, are we just going to leave it there and say, well, it only serves an administrative purpose? We know who was paid on what date, and if there's any auditing or something like that, we can always prove that the payments took place because we have our administration in order. Well, that is, of course, one way to look at claims data, but it is important to realize that claims data has an enormous potential when it comes to data mining exercises. So it allows for a lot of analytics, a lot of statistical analysis that provides us with a lot of useful information. And if we manage to leverage claims data effectively, we can make healthcare more accessible, of higher quality, and more affordable. Therefore, in this presentation, I'm going to briefly outline how we can leverage claims data using big data technologies. So computer science, data warehouses, etc. So it's going to get technical, but it's important to understand that we are now going to make a jump from using claims data for administrative purposes and going to using it for analytical purposes on a large scale. In this image here, I can briefly portray 3 different domains that are necessary when we are talking about data science, right? So on the right-hand side, we can see computer science. And we can also, that has to do with the actual ability to know how do you manage a big data set? How do you get it from A to B? How do you analyze it? So those are the computer science tools. We can also see on the left-hand side the mathematical parts. If you want to do any type of analytics, you need to understand statistics. You need to understand machine learning or regression, and logistic regression and things like that. And the upper circle, called domain expertise, that is where you will need people that understand the field that they are analyzing. So if I'm trying to analyze information about airports or flight traffic, I need a person that understands this domain. I need a person like a pilot or an air traffic controller that can help guide me in saying, you know what, these are the indicators you should focus on. This is good, or if this is high, it's a bad thing, etc. So you need domain expertise. And when we're talking about data science, in this context, data science really is the intersection between these three overlapping domains. So domain expertise, computer science, and mathematics. And that is very important to take into account because we will be coming back to this later as well. So you may ask, what are the benefits of claims data, or why should I analyze claims data? Well, it's actually very simple, because claims data in the medical field is in fact the most large scale and reliable and complete type of data compared to other types of data that we find in the medical setting. And the reason is very simple. It has to do with payments. As a healthcare provider, you may not always have all the time to fill in all the necessary paperwork and meet all the requirements when it comes to filling in forms, etc. But providers will always have time to do that paperwork that is directly related to receiving payments, because they know if they don't fill in this, I will not get a payment. So consequently, the volume and the reliability and the completeness and the timeliness of the claims data usually is of much higher quality than other types of data where people have a more voluntarily attitude, where they say, well, you know what, I'm just going to skip this form for this time, or I'll fill it in tomorrow, etc. And then they end up never filling it in. Whereas with claims data, simply because it's related to their payments, they will generally submit this information on time. However, claims data, of course, also has its limitations, right? So first of all, claims data generally lacks information about medical conditions and health outcomes. And this has to do with, for example, if a patient goes to a laboratory and the laboratory sends a claim to the insurance company only knows that the laboratory test has been paid and that the patient went to take that laboratory test, but there is no way of telling what was the outcome of the test. Is the patient sick? Is the patient healthy? Did he score positive or negative? There's no way of telling that from claims data. Claims data is not designed to capture medical information. So we can only make certain inferences about medical information. We can, for example, say, hey, everybody that uses insulin, that has claims data for insulin usage, is probably a diabetic, but those are inferences. We can't know that for sure from claims data alone because it is not medical data. It is meant for billing and financial purposes. Second, claims data allows for observational studies only. So when you are studying a population using claims data, you are just observing this population in their natural habitat as it is. You are generally not intervening. There are no ways you can control experiments. You can't say, okay, well, this group we're only going to give this medicine, or this group we're going to control by using such and such factors. So claims data generally allows only for observational studies, and therefore, if you're talking about controlled experiments, etc., these are usually not quite feasible with claims data. So you have to be also aware of what type of research you can do with claims data. All right, so now that we have the basic premise of what data science is and what claims data is, we're going to our next part of this presentation, where we're going to cover how we can leverage claims data to generate actionable insights. So claims data can be used for a wide variety of health-related questions. I have here a few of them. Public health questions can be answered by using claims data. You can measure the health of the population. You can see how much is consumed of certain types of medicines. So a lot of things you can, how much hospital admissions or readmissions. You can check the cost of care, what it costs. The quality of care you can also measure by certain parameters. For example, hospital readmissions after the surgery, if you use that as a quality indicator. These are also things that you can derive from claims data. We can also do some forms of cohort studies. If we know, hey, this particular group of insured people are using such and such medicine, we can also follow a particular cohort and see how their behavior in claims data consumption is maybe different than the rest of the general population. Moreover, with claims data, we can also do fraud detection. We can do statistical analysis and see, well, hey, maybe this doctor over here is invoicing a lot more than all of his peers. And such questions might invite to further investigation, sometimes leading to fraud. And we can use a lot of statistical methods by which we can detect outliers and figure out, well, this person is probably, it might be busy with some kind of fraud. Also, when it comes with claims data, we can also monitor and track the patients over particular pathways. So think about it. Certain pathways are certain pathways of care or certain conditions of care are stretched over a long period of time. A person might first go to a physiotherapist, then go to get an x-ray for the knee, then get an orthopedic surgeon to do surgery on the knee, then go to physical therapy again, then go to the pharmacist to take antibiotics for the knee surgery, etc. So we can already see that certain episodes of care form a whole line of data that we can follow, and we can follow patients like this. We can follow patient groups by using methods such as process mining, where we can create process flows based on the flow of patients between providers or the flow of patients in a hospital setting. And this is also very valuable information because it allows us to do interventions that are related to the logistics and supply parts, the logistics and supply chain parts of healthcare. And finally, you can also use claims data for budget monitoring. So we can have, for example, a form where we have a budget where we have realized target performance, and we can also have a realized performance. And then we can use claims data to measure in real time to what extent our performance, when expressed in money, is meeting our targets or our budget targets that we have set for this year or for this quarter. So those are a lot of things that we can do with claims data. And now you might say, well, Dennis, that was a lot of information. There's a lot of data, but how do I get started? Where do I even begin? There is so much data. It's just overwhelming. Well, don't worry, I've got you covered. What I actually recommend when it comes to data science projects using claims data is to simply use the Dunabedian framework for assessing the quality of care. And this is a framework has been introduced decades ago, and it is very useful in being able to separate your research questions in different categories. So you have here the structure, process, and outcome. And if you think about things like structure, when you're using claims data, you can answer questions such as how many doctors are there, how many patients are there, how are the doctors distributed geographically, what kind of equipment is there, what kind of capacity is there. So these are things that you could approximate with claims data. On the other hand, we can look at questions that are related to the process. Here we can ask questions such as how many consultations are being done by doctors, which consultations usually are followed by what activities. We can use process mining techniques there. We can use machine learning techniques to categorize people according to groups. So the bulk of claims data activities will have to do with the part where it entails processes, because there inherently the patient is interacting with the provider, and there's always some kind of process going on in the supply chain there, in the healthcare provision there. And finally, we have the variable outcome. And in outcome, we measure things normally such as morbidity, mortality. But the issue here with claims data, again, claims data might not have sufficient information to be able to give a lot of information about outcome. So, but nevertheless, we can still infer certain things about outcome. For example, if you want to use hospital readmissions as a outcome indicator, which is often the case, we can say, well, any person that is readmitted to a hospital within 2 weeks of having had a certain surgery is considered a readmission, for example. And we can define such parameters in claims data, and then we can say, well, this hospital has more readmissions than this hospital over here. So we can also use claims data to a certain degree to get information about outcomes. So what I would really recommend is if you're approaching a claims data project, or if you're ever in charge of creating a dashboard that is based on claims data, etc., then you can use a framework like this to give more structure to the data that you're going to use and to be able to communicate more effectively to stakeholders what you're doing with claims data and how your claims data is contributing to the organization's goals.
2 minutes left.
And very importantly, what I would really like to stress is that we need to think more and more about the synergy between these three fields, because we are now at an age where we are pivoting towards a fully digitized economy and a fully digitized world, otherwise known as the Fourth Industrial Revolution. And in that particular context, it becomes more and more important to consider the future of health economics and the future of healthcare analytics and healthcare monitoring that should be data-driven. And in order to be data-driven, we need to make sure that these expertise overlap. Because too often we will find in a particular company where, for example, the person specializing in computer science is just the IT department, and that person might not know anything about statistics and mathematics, or might lack the domain expertise. And we might also find on the other side that the people that have the domain expertise, for example, a medical professional, simply does not know anything about the computer science aspects, about how to make sure that large volumes of data can be processed and how to make sense of that. So we find that people might be very good in domain expertise, but lack data literacy. And what we really need to work forward in the future is to make sure that the competent policymakers and the competent supporting personnel in our healthcare systems have, at least in a team network, a degree of overlap between domain expertise, computer science, and mathematics. And that synergy is what will allow organizations to effectively leverage claims data. And finally, this will then, in turn, increase again the accessibility of healthcare, the quality of healthcare, and the affordability of healthcare. Finally, I would like to say that if you're interested to know more about data science for healthcare claims data, I have packaged a lot of my information about this topic in an online course, which was the direct reason why I was invited to this presentation. Has to do with this online course available that explains the more data, the more technical savvy parts related to claims data. Thank you very much for your attention, and I'll be happy to answer any questions you may have.